Welcome everyone. My name is Suzanne Jolly. I'm from the UBC campus at Vancouver, but I'm very happy to be moderator for the next two sessions. And I'm really pleased to be able to present our American colleagues, and it's pretty much America across the country, which is really excited about. So Heather Zesiger, got it right? And she is the Director of Health Promotion at Emory University. Marci Torres is the Director of Health Advancement at Montana State. And Paula Swinford is the Director of Wellness and Health Promotion at the University of Southern California. And Starr Wharton is the Associate Director of Campus Wellness at the University of Southern Carolina. Correct? I've got that all. I just got to meet them, so it's great. I also want to just recognize for a moment that we are on the territory of the Okanagan Nation, and that we're very lucky to be able to be on this land today, and to be able to recognize the traditions and the cultures of the Okanagan Nation. So thank you so much, and I will turn it over to our lovely presenters.
Thank you. So welcome, everyone. I am Paula Swinford. I am the Director of Wellness and Health Promotion. I'm very aware we were talking about words and how words shift and change. We've only been Wellness and Health Promotion for a very short time. We were Health Promotion and Prevention Services before that, and our students told us they wanted nothing to do with prevention. So, you know, all that. Let's see. So my job is to give you a bit of context. I'm going to be very brief because we have a lot to share with you, and then we're going to engage you because we really felt that a talking circle was about back and forth and not one way. So my job right now is to acknowledge our elders in that 40 years ago, there were a handful of us, literally a handful of us, hired in the United States to be health educators, I think is what many of us were named. And we were hired by healthcare facilities, the clinics on campuses, primarily because they had no idea what to do with the drug use at that point in time. And that was just on the edge of, we weren't into alcohol yet, we were still doing the 60s. And I've been through several of these waves, it's fun to watch them. But so 40 years ago, and at some point in time, those more learned than I drew us together, I think it was in 1985, to talk about what the CDC was doing around health objectives for the nation. And health objectives for the nation that were written out and then became what is known in the States as healthy people. And what's fascinating to me is how that really was a network of colleagues that wanted to comment on those objectives. And at the time, although I didn't have the language then, but we were really trying to help those objectives be more salutogenic rather than pathogenic. And that's been a long-term conversation that just keeps raising its head. So salutogenic is my new favorite word. I have a favorite word quite often. So out of this was a conversation that happened to happen within the American College Health Association. And I say happened to happen because it could happen many other places. It just happened to be where we all showed up, all 12 of us. And in that conversation, Karen Gordon, who was the Director of Health Education at Princeton University at the time, really pushed us, and Patty Lubin, who was the Director, a health educator at Northwestern in Chicago, pushed us to look at these objectives. So let's fast forward. These objectives have been through many, many generations. And this last generation, I have to put my hat off to a woman who's in the room, although I think she may be texting at the moment, we won't all look at her, is Michelle Burson, who really in many ways brought to life a body of words, you know, so that sense of really enlivening a set of words to create a concept of healthy campus, and has moved that forward. There is another colleague, Allison Smith, who is at NYU, and Allison is also working in that kind of hyper context. So I'm going to be quiet and say now that we're going to give you snapshots of what healthy campus looks like on this campus, on 5 different campuses. And then we are going to open it up to you to talk about how this moves from where it's at to where we imagined. And my last thing would be that, to say that we have always imagined something different than where we are at. And that is both an incredibly enlivening, exciting place to be, and also an occasionally frustrating place to be. However, being at this kind of conference makes it more good than not so good. So, and with that, I'm going to turn it over to my colleague Heather to kick us off talking about our campuses.
Sure. Hi, everybody. I'm going to use the mic for the benefit of the video. I'm getting a thumbs up from the gentleman on the back. Maybe, once I figure out how to use it. On. Is it on?
Yeah, it's good.
It's good for the recording? Okay. So it's such an honor and a privilege and a real pleasure to be here. This is probably the best continuing education environment I've been in the 10 years of my career in higher ed. So kudos to the conference organizers and to all of you who are doing really vibrant work and sustaining us. Something that came up when we thought about, do we do incremental change or do we do, I guess, quick change? In light of Dr. Keeling's comments this morning, as somebody who manages a team of health promotion professionals in higher education, my biggest concern is burnout. Because I brought in some amazingly talented, committed, passionate people who wanted to do more than incremental change and were just crushed by the political system of higher education and really felt that their service to students was at odds with some of the other concerns of the university. And so that's a real challenge. It happens, I'm not calling out my institution alone in that, it happens everywhere, it happens in any political system, and universities are certainly a political system. So I think having the opportunity to be here and to recharge and to connect with people who are curious and questioning and challenging has just been personally really relevant, and I have a whole list of partnerships to reinvigorate when I get back to my home campus. So I hope you have that. I hope you have that chance to apply what you're learning here. It will help me to know how to frame my brief comments about two campuses. I'm doing a little bit of a compare and contrast. It'll help me tailor that if I know a bit about who's in the room. So US folks, if you could just raise your hand. And those of you with your hands raised, keep them up if you have a coalition, a Healthy Campus coalition of any sort. Okay. And then folks who are not from the US, raise your hand if you have a Healthy Campus coalition, steering committee, Healthy University leading group, Healthy Campus leading group, sort of. Okay. So what came to my mind when the call for proposals went out, and something that I thought might be meaningful to share in an international context, had to do with motivation and structure. So I'm curious about the motivation for forming a coalition, who that comes from, because generally there's a person or a working group or a mandate. Sometimes it's bottom up, sometimes it's top down. Where does that come from, and then how does that impact the outcomes and the day-to-day functioning of the group? And that also can have to do with structure a bit. So I'm going to talk briefly about my home campus of Emory University in Atlanta, Georgia. We're a private institution with about 15,000 undergrads and graduates evenly split. I'm very fortunate to have amazing students from across the campus, but in particular the School of Public Health is a really great partner, and so we offer that living laboratory for their students to really practice health promotion in a campus setting. And then I'm going to compare and contrast us with my colleagues' work at the Georgia Institute of Technology, or Georgia Tech for short. They're just across town from us in Atlanta. They're a public university, and I think we're just a good starting point to talk about motivation and structure. I hope I'm going to draw now on the board, so I'm not going to hold the mic, but I think the visuals will be more important than what I might say. Okay, so I'll talk about Emory. And at Emory, we sort of have two coalitions, and they're not in competition, but they've grown up parallel, and I want to think, maybe you can help me think about how they might merge. So we've got Healthy Emory, which is the newest, and then I'll talk about the other one. Healthy Emory was motivated by HR, our human resources, because they are employees of a common insurer, and they want to reduce employee health benefits costs. So very much, to me, a financial motivation. So there's Healthy Emory. There's an executive committee with very visible, high-level leaders on campus, Dean of the School of Nursing, our Dean of Student Affairs, people in healthcare. Emory runs also a healthcare corporation. So we've got those folks, and then we've got, I'm on the steering committee, which is more, as you might imagine, kind of the worker bees. And that's sort of as far as we've got right now. So they're maybe 3 years old. Again, coming motivated by human resources with a very clear financial goal of creating a healthier workplace, a healthier employee population, and then they remembered that there are students there. So then we got invited to the table. We don't have the same financial incentive. Our students are required to have health insurance in order to be enrolled, but there's not a common insurer, and their needs are obviously very different. So there's not that clear financial component. So I think that's just an interesting origin and motivation. Then we have what's been going on for more like 5 to 6 years, which is Flourish Emory. And it was renamed a couple years ago by our students. It had been called the Healthy Campus Coalition. They wanted it to be more custom to our university and to speak to them, so they renamed it Flourish Emory. It has staff support from somebody in our Office of Health Promotion, and then just lots and lots of student volunteers. And they're focused more on intervention, so they've created an intervention called the Happiness Boot Camp. And it moves participants, its outcomes are that it moves participants along Dr. Corey Key's scale of flourishing, which some of you may have heard of, and there was actually a session in this room yesterday about his work. And so it's a resilience, positive psychology, very asset-based look at mental health and mental health promotion. And so as students participate in the Happiness Boot Camp, they're learning skills. It's very much at the personal skills level, and then we're trying to think about scalability and how to make that population-based. So a little bit of staff support, a whole bunch of students. I should put in here there's an advisory committee of staff and faculty. How it got here was that after our 2008 National College Health Assessments, we used the ACHA and CHA2. In 8, it was still the 2. It was the 2 at that point. We got that list of determinants of academic impediments, health-related academic impediments, impediments to academic success. And we looked at that, and we wanted to know a lot more. We wanted to do a lot of qualitative work. So my colleague Mark Cordone, who helps enable all this student-driven work, he spent a year just talking to small groups of students. And he would ask them how health, Emory culture, and success. Like he would just listen, and these were the things that kind of came up as he would share with them some of the data points. He was going to tell us more, unpack this for us, and then he would ask them to kind of connect these themes that were coming up. And in almost every group, it became that Emory culture is such that you have to sacrifice your health in order to be successful. And he heard this from graduates, undergraduates, all different disciplines, colleges within the university, different ethnic backgrounds, just pretty much universally this is what came up from that qualitative research. And so from this, they found their mission for Flourish Emory, which was to basically try to dismantle this. How is there a way that success and health can coexist and that students can recognize that interdependence that we're all here talking about, but how do they make meaning of that in their lives? And from that came the skills training, which is where we're at right now. They're also looking at things that are more systemic and I hope are successful. They would like to see a health and wellness statement in every syllabus on campus. They thought anthropologically about a campus setting. What are the symbols of a campus? What are the rituals of a campus? And they came to the conclusion that syllabi were a very common unifying force and very valued in that it communicates what's expected, what the university values, what the faculty member values. And so they're slowly, and I wish them all the luck in the world, there's this incremental change. They're trying to get an acknowledgement of that relationship between health and wellness and academic success in a syllabus to the extent that a faculty member might mention it, might give it some value, and encourage students. It still comes down to the personal level, but encourage students to seek resources to both bolster that success and in the event they're feeling just of some sort to seek resources. So as far as motivation, in this case at Emory, the student motivation came out of the qualitative research. I promised to talk briefly about Georgia Tech. They have a much more what I would call traditional model. University of Florida was one of the first campuses to have a Healthy Campus Coalition, and theirs was charged by the Vice President for Student Affairs, so top down, I'm sure with a lot of staff input to get there. And then a bunch of committees by capacity, or by, not necessarily topic, but by, so they would have like a marketing committee, function, thank you, functional committees, which is different. Some schools will have topical committees, and that's an option. So marketing, policy, data. That might be about it. And so that was UF's, University of Florida's model, with staff and students and faculty mixed into these by their interests. And then they would use their metrics, be it the NCHA or Healthy Campus, to inform these things. Georgia Tech took on a very similar model. Their director came from UF. He arrived on campus, and their motivation was really personal interest. And so their director of health promotion and their director of campus recreation, which is our more physical fitness-minded wellness work, they got together, they said, why aren't we collaborating more? Look at all these partners. And so it was very personal motive. So I would say their motivation was personal, knowing that it was an emerging best practice, wanting to be very evidence-based in their practice. And so the two of them, for really the last 8 years, have driven that, which is personal zeal. And depending on the campus and what your outcomes need to be and what your metrics need to be, that can work. Theirs is very event heavy, so health fairs, highlighting collaboration, highlighting partnerships. And so at UF and Georgia Tech, that's been kind of their motivation and their structure. I hope this is helpful. It's meant to be sort of a compare and contrast. These are all different options. Obviously now these were things that were coming up before there was more of a toolkit. Now there's an amazing online resource, so if you want to create something more consistent with what is emerging as best practice and how to use the national metrics and then adapt those to your campus and then measure them, all of that exists online. We have a single page handout. If you're going paperless, you can just take a picture of it and leave it behind, that's fine. We'll pass those out, I guess, at the end of our talk. And that'll take you to the link to the website is on there. And that's, again, testament to Michelle and Allison and their great work.
So I guess I'll go now. I'm Marci, and I'm actually going to talk to you a little bit more about some of the challenges with developing Healthy Campus and some of the roadblocks that we run into at the two institutions that I've been fortunate to work with. I was hired about 5 years ago as the initial director of Healthy Campus Initiatives at the University of Oregon. And that came from a proposal that was developed by director-level positions in the Division of Student Affairs. So PE and Recreation, the Health Center, HR, the Career Center, some of the different divisions or the different offices within the Division of Student Affairs. They went to our vice president of the division with this proposal, and basically her attitude was, if you can get the money to fund it, I'll support it. So in theory, the support from top down, which is necessary to be successful with these types of initiatives, was there. And the support from director level, in theory, was there. There was no student involvement. And I think, as everybody knows, in higher education, student involvement is key to making anything successful. So that kind of set the stage for how things started when I got there. The other piece that was left out of that proposal, even though the intent was there, the division between health promotion, as it exists on US campuses, and having a separate Healthy Campus position. The benefits of the way this was structured at the University of Oregon was the Healthy Campus Director reported directly to the Vice President of the division, which gave the voice for health and well-being at that level, which is very necessary for any of this to be successful. But there is so much crossover between health promotion and Healthy Campus that without that conversation at the beginning, at the development stage of these types of initiatives, you're pretty much setting yourself up for failure. So a large part of my first year there was developing those relationships with the people who actually developed the initial proposal for the position, and understanding the dynamics of the relationships between the Healthy Campus person, not as somebody coming in to take over those efforts that were already in place, but how could you work together, how could you build those relationships, and how could you build the momentum behind this Healthy Campus initiative. And so coalition building at its basic, finding that end goal that was the same, all those preconditions that have to exist in order to reach that end goal, and where people were already making those efforts to have that end impact that we were looking for. And again, without that top-down support, truly having that support, none of those efforts are going to be successful. The student support, it was a lot of working with student government and going in and in looking at how you're developing your coalitions now, if you are doing that, going to student government at the very beginning, having them involved in the process is going to be key, and getting their input. We have data sources that we use for issues, the impediments to academic success that Heather mentioned. Those are all done through surveys, but there's a human element that gets lost in just looking at data, and having those conversations with the student firsthand really can impact the areas of focus. So when we look at wellness, you have all these various topics that you're looking at. We decided that what we were going to do was start small. And I know we don't need to, we talked about incremental change. Unfortunately, with our environments the way that they are, sometimes that's necessary to gain some momentum behind what you're doing. So we started out with some of the easier, quote unquote, easier topics: physical activity, nutrition, stress management, and work from there. And as you develop those small successes, you can build on that, gain momentum, you get more partnerships, people are more willing to contribute to your efforts so that you can expand what you're trying to, you expand your reach, looking into more mental health in general, physical activity, nutrition, stress management, sleep hygiene, sexual health, any of the topics that we need to look at, and across the spectrum, students, faculty, staff, and how the interaction of faculty and staff health and well-being affects the student success. So again, starting small so that you can gain that momentum and build from there. So I'm going to go ahead and, just in the interest of time, allow some of my colleagues to talk a little bit more, but just we can, if you have questions about some of those challenges, I'm happy to expand on that and get more into detail on how we work through them. As we went through the 3.5 years that I was there, they have continued on their Healthy Campus efforts. It is still growing and developing. It is not part of the culture. It is not part of, there hasn't been complete institutional buy-in yet, so I think the level of frustration can be very high, so as long as you know that going in, I would encourage you just to keep pushing through, work through some of those challenges, have those lots of coffee meetings with individual people to develop those relationships, and really bring the students into your process.
Hi everyone, I'm Starr Wharton. I come from a very unique perspective that I started out as a student at the University of Idaho developing a Healthy Campus initiative, but I didn't know that's what it was at the time because I was just a little old student, a superior educator, and in my sorority I noticed there were problems and I said, well, we need to get something going here. So I got together with other girls and guys on campus and we put together a coalition of students that were just really interested in health and wellness in our Greek and fraternity and sorority life area, and had no idea at the time that's what we were doing. We didn't have administrative support. It was completely fraternity and sorority life led. We all funded it within our own chapters, and it actually worked quite well because we were just doing all of our philanthropies as normal, but adding a health component to it. So that's where we started from, and then my previous position, I'm in transition between positions right now. I was at the University of Nevada, Las Vegas for the last 7 years, and when I came into that position, I was told the first thing was we have students who really, really want to get stuff done. And I said, yes, love it, because students that want to get things done, great. Well, what they wanted to get done was they wanted to make sure that we were able to give out safe sex kits on campus. The administration at the time, specifically the president, did not believe in giving out condoms on campus because it promoted sex. And therefore, in Las Vegas, and yes, this was only 7 years ago, we were not allowed to give out condoms on campus unless you went through a healthcare provider. That seemed a little bit interesting because of Las Vegas and the ideas there, but you should know we're a very conservative area. Las Vegas is actually extremely conservative culturally, and politically, so there are some interesting dichotomies there. So I didn't know this going in, so this was really good for me to learn about, and I had the most motivated students. They also had a student health advisory committee that had been disbanded because students were not interested. It's an urban commuter campus there, which, how many of you have more of a commuter campus focus with older students that you're working with? Okay, so big challenges, right? And especially that student engagement and continuing engagement. So we didn't have a problem getting students interested, we had a problem keeping students on campus interested because they got to be working other jobs, and if they didn't see positive changes happening, like we said, they didn't want to do anything with it anymore. So over the past 7 years, we really developed our peer education program and focused our peer educators or peer leaders or peer counselors or peer mentors, whatever terminology you want to use for that, as being our focus area. And I work with the Bacchus initiatives of NASFA, National Student Affairs Association, since an international association, so any of you all can be involved with that. We really are developing peer education looking at how do peers and the students lead healthy campus initiatives and lead the healthy campus ideas, because we can all do it as an administrative roles, but we're, eventually some of us will leave, hopefully, and it's not just going to be on us, but we want our students to really be the ones that bring this forward, and they have so much more power and capacity than one of us. 5 students can reach so many more. So from my perspective, that's where I've looked at it. We do not ever get the presidential support. We've gone through 4 presidents at the University of Nevada, Las Vegas since I've been there. And this most current president, who just was hired, is a gentleman with business background, and he's actually very interested in it. So ironically, he's the only business gentleman, and he's very interested. So I'm hopeful that they are going to be able to continue there. I start a new position in a couple of weeks at the University of South Carolina, which does have a Healthy Campus initiative and a Healthy Campus program that has been in place for 10 years. 10 years, correct? Now, and Michelle's actually started that program there on campus. So I'm very excited to be going into a campus that has something more solid, but it also does have that student engagement. One of the things I've already been told is I'm going to be responsible for more student engagement. So that's my background and where I'm coming from.
So talking points, the piece that I'm going to bring to this is how fluid this work is, and a couple of important points were the movement towards creating Healthy Campus at the University of Southern California initially came from our head of our health service. And unfortunately, the head of our health service, while being a world-renowned adolescent medicine specialist, had no idea that health existed outside of adolescent medicine. Smile if you know someone like that. And so unfortunately, as in trying to build a coalition on the campus, the question becomes, whose agenda are we promoting? Whose agenda? And who gets the spotlight and what's it all about? And very, very quickly, my colleagues on campus told me, the Director of Wellness and Health Promotion at the time, that they didn't want to play. And there was no money in it either. Although we had all the health fee money, it wasn't getting shared. So basically, although there were objectives chosen, there were 10 for students, there were 10 for faculty and staff. We met a couple of those, but just by chance. There was, in that period of time, there was a great deal of unrest. What came out of that, though, was a group of people that called themselves WALI. WALI stands for Wellness and Learning Initiatives. It is a Healthy Campus Coalition. WALI was much more about levels of engagement and what I now understand to be salutogenic measures rather than pathogenic measures. How many unplanned pregnancies are there? How many chlamydia cases? But more about, at what level are the students satisfied with the groups that they're involved with? So WALI, interestingly enough, had a really good 8-year run, okay? And this last year, what became very, very clear is there is a need, or there is a desire at USC to elevate health promotion beyond a service initiative. Now, the question that I have, and I'm one of these people who gets very stuck and very attached, so I have lived in the same community for 35 years. It's a rare thing these days, and so when I heard Richard Keeling talking about being of a place and what that means to be of a place, you know, I can't do it any other way. Can't do it any other way. So, again, a hometown girl kind of thing like that. But the piece that is interesting to me is to watch our Vice President of Student Affairs, Vice Provost of Student Affairs, create a position that is in fact supposed to elevate this, at least to his level, okay? Now the question that I know is we now have a new provost. Yes, and I'm glad for that. That's the best way to say that, right? I'm glad for that. We have a new provost, and he is a neuroscientist. And word on the street is that he too is very interested in this idea of a health promoting campus. And I'm waiting to see whether or not that gets street play. Because in fact, I think there's a huge difference between gathering a group of colleagues together and creating a collaborative around services that then measure themselves against something, right? Some assessment over maybe 3 years if we're lucky. You know, lately it's been 6 months. But so that's a very different thing than looking at a place, an institution, and having it be health promoting, having a chief wellness officer, to have health in so many conversations. And so it's all a journey. It's all a journey. I can tell you we are not where we once were, at least from my perspective. We are absolutely not where we once were, both as a field and as an institution. However, I think the questions that we bring is really one of systemic organizational change and what these healthy campus coalitions will look like going forward. Because I don't think they're going to be about the services we provide. The services, you know, so the services for the students, the services for the faculty and staff, you know, do I get a free gym pass? You know, did I need an objective? Was the objective pathogenic? Was it salutogenic? There's something different that's brewing, shall we say, brewing. And I don't know what the mix will look like, but it's very exciting to see that possibly where we're going. I know that we have about a few minutes left, and we're curious about what your thoughts are, your questions are, and so we are opening it to the floor, and anything you need to say or would like to ask. Yes. Please introduce yourself, though.
I'm Susan Harrington. I'm a Chief Wellness Officer at Oklahoma State University, and I hear what you are doing, and I think one of your keys that you said that your president being a business person is key, because they get it. They get that there is a return on investment, a value on investment for having a culture of wellness permeated. It's come through worksite wellness in the past, and so you know, I've been really lucky in my position. I've been there for about 18 months, and that I strategically coordinate all things wellness for our students, our employees, and our communities. We have 10 campuses, 77 county extension service offices, and I think it's so important that the coalition building is imperative, and it's got to be cross-sectional. It's got to be your grounds. It's got to be not just health services and wellness promotion, but your grounds, your transportation. It just has to be that health in all policies concept. And kudos to you guys for what you're doing, and thank you for laying the groundwork for my position.
Just kept shoveling.
And to speak to that,
Mark McLaughlin, I'm the president of the University. Just to speak to the Emory discussion we had, where you have your two, kind of, not competing, but your two kind of organizations going, I'd say the last thing you want to do is merge. When we talk about doing merge, because although you might have the same values, your kind of mandates are kind of different.
Yeah.
And the staff from the HR, they have clear objectives. But they don't really have the boots on the ground. So they're really going to want you guys to come aboard. Let's kind of merge. They're probably the ones going to be pushing the merger. But you gotta keep these things separate, let them flourish, let them bubble on their own. And, the last thing I do is bring them together.
Thank you.
Just dilute both.
Question. My name is Sheila Blackstock from Kamloops.
From where?
Kamloops, TRU. I'm a faculty member at School of Nursing, but I also have a research interest in occupational health nursing and organizational change and workplace cultures and environment. So curious to know what type of framework you have been working on or utilizing or informing your services with. And secondly, how do you integrate an intercultural lens into your services so it's amenable to your population of students?
So I think there, and help me if I don't paraphrase this correctly, but I hear two questions there. One is about framework, and the other is about cultural appropriateness and representation and inclusiveness and words. So rephrase that a bit.
So,
Services being appropriate.
right.
Yes,
Because
okay.
you have a diverse population.
Right. So I think that one of the questions that again goes back to this coalition, is the coalition about doing the services because you haven't resourced those services. So you haven't resourced those services, so you've got to bring a whole bunch of people together around campus whose job it really isn't, to then begin to do these things. Or is the coalition about guiding and empowering and providing services? And so there's different levels, and I would have to say that the coalition works really well in that sensitivity aspect. It works really well if you've got a bunch of people who have some extra time and are excited about this, and they happen to be from the LGBT Center and CBCSA and Asian, and then we'll all get together and we have breakfast together and we catch up on their children, and then we do our thing, and it informs that, and it goes back to all these places. But that is not the same as having a coalition at a different level that is then creating enough resources to begin to, in fact, do what we all know as health promotion professionals, which is to attend to the services of the population that are there as they define them. And so those pieces are different in my mind. And I don't think, I'll be really candid, I don't think I can provide with 4 staff members and a bunch of people part-time who show up once a month to talk with me about this, services for all the different communities. I mean, there's 144 different countries represented at the University of Southern California. Okay, and it is the most, in the United States, it is one of the most diverse campuses that you can walk on. I mean, so it's like the logic on the ground doesn't match for me at this point in my career. Maybe 20 years ago I would have tried to do it all. I don't do it anymore. Others want to?
I'm just going to say with the framework, primarily the framework is we follow the ACHA standards for health promotion and higher education. So it's our base framework, but we add in CAS and some of the other standards.
And the Ottawa Charter.
And the Ottawa Charter does help us a lot as well, although we don't have a formalized framework at UNLV that we actually had in place.
Great, and just to framework and inclusivity, I don't think we're doing enough. I think it's a good start, basing it on the respondents to our NCHA who are representative demographically of our campus is at least a bar. I think you have to at least, it's a low bar, but I think you have to start with that. Who are we talking about when we cite these numbers and statistics? The qualitative groups were even more representative, and so that's helpful. With employees, I think that's a challenge, and just different types of work allow you to go to a focus group versus others, or you have time and you have a computer and a private office in which to take a survey, or you don't if you're in more of a service position. So I think with employees, the inclusivity and representation is a bigger challenge.
Susie, you had a question?
I was just going to say, as far as the model, one of the first things when I came on board, there wasn't a model that we needed that was very comprehensive, that addressed socio-ecologic, addressed all the dimensions of wellness. So we actually developed one. We had to develop a definition of wellness, a model, and then the framework, the structural framework. And part of that is like your peer leaders. We have innovators amongst our employees. We have peer leaders, so that's the top bottom-up approach. But we do have a framework, and I have a copy of it because I presented on it yesterday, that I'm welcome to share, I'm welcome to talk to anybody. It's been very well received across a variety of different venues, whether local, state, national, and now international. It was very well received yesterday. Again, I'll be more than happy to share it. It's very translatable to almost any setting. It's very evidence-based.
That's excellent. One of the things I'm aware of, it's fascinating to me how many networks there are, and the networks from the different places, and that somehow the states have not figured out how to do a network of health promoting universities and colleges. So that's on our to-do list. So don't listen to us when it comes to creating anything, quite honestly. Just, you're far better off in that way. We've got time, so we're going to stop now and turn it back over to our moderator. Thank you for being such an attentive audience.
Actually, can I just add one more thing really quickly? You were talking about inclusivity and making sure that you had, I think it all goes back, you can kind of see it, membership. And again, the language that you use. And I think one of the things, the pitfalls that we fall into in our world is using terms like health, using terms like wellness, and how that doesn't resonate across the campus. And that's one of the things that's helped us at Montana be successful, is changing that language completely. So that, and in that coalition building, in reaching out to people who are membership, have membership in that Healthy Campus Coalition. We're still trying to come up with our name at Montana, because we're trying to take the word health out of it, is helping people realize how everything that they do relates back to student well-being and back to their academic success. It's not just about health promotion people or healthy campus people doing this work, but this is the work that we all do. And we preach to the choir so often. And these are the conversations that we need to be having with our administration, with people in different departments. So I would say when you think about inclusivity, it's about changing our language so that the language is inclusive and making sure that that membership is across the campus so that you do hit all of those special interest groups or people who have specific needs related to their particular area without having to be exclusive by focusing on that one group. So it is a challenge, but I would encourage you to just look at the language that you use and make sure that that membership is broad-based.
Great, I'm going to have to stop you there. Thank you so much for all your wonderful presenters.